My name is Sarah and I'm one of the pelvic health physiotherapists at North Bristol NHS Trust. Today, myself and my colleagues Jen and Alethea want to show you some exercises that can help if you're struggling with pain during pregnancy. Our plan is to teach you some exercises that can improve your overall well-being and fitness. These exercises are safe if you are pregnant and in good health. The video titles and descriptions will give you more information on how to do the exercises, how to make them more challenging, and which ones to focus on if you're struggling with a particular pain. Get advice from a healthcare professional before trying them if you have a health condition, an injury, are not feeling well, and are not sure if these exercises are suitable for you. Stop the exercise if you feel worsening pain or become unwell.
The sciatic nerve runs from your lower back to your feet. When it becomes irritated, we call this sciatica. You have a sciatic nerve in each leg, one in your left leg and one in your right. Pain can be felt from the lower back, spreading down the leg and even into your foot. Sometimes you might also feel pins and needles or numbness. Here are some exercises that might help with sciatica. The first exercise involves sitting on a chair. Start by simply moving your foot up and down. You can then add in nodding your head. Try and make sure that your head moves in the same direction as your foot. As long as you're not experiencing more pain, you can make this exercise more challenging by straightening your knee. Our second exercise is for those who want to combine a few exercises together. The aim is to try and flow from one position into the next. Start on your hands and knees in a crawling position. Take a breath in as you arch your back upwards and move your hips towards your feet. Then breathe out as you scoop your hips forwards. As your bump gets bigger, it may be more comfortable to try separating the knees slightly. You may also feel a gentle stretch on the inner thighs as you try this.
Many people find movements like getting in and out of the car or in and out of the bed difficult. Here are some tips which may make these movements easier. To turn in bed, you can try alternating your leg position. When on your side, try keeping the bottom leg straight and the top leg bent. Breathe as you turn towards the middle and pause halfway. Here, take another breath in and out, then swap your legs over. So the bent leg is now straight and the other is now bent. Before you turn, try lifting your bottom up and use your bent knee to turn to the side, then reposition the pillows as needed. Another option would be to trying to roll under. Push up onto your arms, then onto your knees, and turn towards the side that you want to go. To help move from sitting down to standing up, try tilting your pelvis forwards and backwards first. If it helps, imagine your pelvis as a bowl of water. When you slump down or tilt the pelvis backwards, you tip water out and back of the bowl, and then you sit up tall when you're tipping water out the front of the bowl. Try keeping your upper body still as you do this, and then you can also add in some circles and rotations. Then when you go to stand, dig in through your heels and you can press your hands into your thighs if this helps. Sometimes doing some pelvic tilts in standing or shifting your weight between your feet before you start walking can be helpful. And remember, keep breathing normally. This can be a great movement to do when getting out of the bed in the morning or after sitting on the sofa for a while.
Some people can experience dull or even sharp pain in the pubic bone in pregnancy when they're moving, and lots of people are scared to open their legs in pregnancy due to pain. You don't need to be fearful of this movement. Opening your legs isn't damaging or harmful, and the pain that you may feel when you open your legs isn't there because of an injury. Here are some exercises that might help this movement to become more comfortable for you. Start in sitting and place a piece of paper under one of your feet. Practice sliding the leg outwards and then back in. You can start with a really small movement and gradually build the distance up. Once this becomes more comfortable, the next step is to lift the leg over a small object. And as this becomes more comfortable, you can start lifting your leg a little higher. Finally, as this becomes easier, you can try standing up at the end. Breathing out and using your fingertips to press into your thighs might help with standing up. And when you're up on your feet, tensing or squeezing your buttock muscles, or even trying a pelvic tilt, might help you get moving more comfortably.
Another exercise to help opening your legs feel more comfortable is a butterfly stretch. Start in a comfortable sitting position, ideally propped up in bed. Start with your knees bent and ankles together. Place pillows either side of your knees and practice fully relaxing your knees into the pillows to create space between your knees. You can stay in this position as long as it's comfortable, and it can be helpful to practice some deep breathing whilst in this position, such as through your nose, pause, and out through your mouth or nose. Don't worry if you can only open your knees a small amount. With time, you can gradually remove the pillows and increase the distance.
Keeping moving in pregnancy is important, and we know that it can also help to manage your pain. Here are some gentle exercises that you can do as part of a circuit or little and often throughout the day to help to manage your pain. As we mentioned before, remember to breathe naturally as you move through the movements and try not to hold your breath. The first exercise is a pelvic tilt exercise. We covered this exercise a little earlier when we spoke about the pelvis being like a bowl of water. Gently rock your pelvis backwards and then forwards to move your lower back. You can also try pelvic tilts when you're sitting on a gym ball or even when you're standing. In standing, you may need to soften the knees slightly, as this will help with the movement. Next, try these exercises on your hands and knees. This cat-cow exercise is one that you may have heard of before if you've done yoga or Pilates. We want you to arch your back as much as is comfortable, tucking your tailbone in, and then moving in the opposite direction, flattening your back on the way, trying to point your tailbone upwards. Try breathing in on the cat and breathing out on the cow. This should be a slow and controlled movement. You can also try this exercise with a gentle twist or rotation to encourage more movement through your middle and lower back and your pelvis. If leaning through your hands is too uncomfortable, you can go on your forearms and move through the movement like I've just described. Or again, use the gym ball so that you can be more upright and resting on your forearms. The ball will move, so this will challenge your core muscles, which are great to keep strong during pregnancy. If you don't feel very safe balancing using the ball, just go back to keeping your hands or your forearms on the floor. Stretches can be a great exercise to help manage pelvic girdle pain. Now, not every stretch will be comfortable for everyone, so give these a go and think about whether you might add any or all of them into your daily routine. This exercise will gently stretch the muscles on the inside of the top of your leg and your bottom. Place your leg out in front of you with the knee facing out and the ankle in front of your pubic bone. The other leg is behind you. You can place a pillow under your leg for comfort if you want to. Slowly lean forward until you can feel a stretch in your bottom muscle. Breathe normally and hold for roughly 30 seconds. Move your arms out further in front for a deeper stretch. The next stretch is for your back. Come onto your hands and knees and then sit back onto your heels. Reach your arms out in front of you and lower your chest towards the floor. Breathe in and out as you hold the stretch here for about 30 seconds. Try moving your arms to the right or the left side to feel a deeper stretch in the opposite side. If this stretch is uncomfortable, try folding a pillow and placing it under your forearms or between your heels and your bottom. In your third trimester, you may find that using a gym ball is more comfortable as it allows more space for your bump.
The following are gentle strengthening exercises you can try. We've included some options to make these exercises more challenging, but it's important to listen to your body and not to push into pain. It doesn't really matter how many you do, but what's more important is that you work within your own limits. Feel free to increase the number of exercises so that you challenge the muscles, but not to the point where it causes pain during or afterwards. If this happens, reduce the number you're doing or go back a step and make the movements a little easier. These movements should be performed in a slow and controlled way. There is no rush to get through them. Focus on the quality of the movement and your breathing. Start with some gentle squats. Use the back of a chair or a worktop for balance if needed. Keep your feet flat on the floor and move your hips backwards. And breathe out as you stand up. Squat to a depth you are comfortable with. Even if it's a very small squat, do what you feel that you're able to do. To make it harder, you can do an air squat without holding on to anything, or even adding some light weights, which you can build up gradually as comfort allows. Here is a lunge exercise. Use a chair for balance if you need. If you are experiencing pain, especially at the front of the pelvis, you can start with your feet closer together and change your foot position and the depth of the lunge as comfort allows. Remember, your pelvis is strong and it's resilient. To strengthen the inner thighs, you can use a pillow in between your knees and squeeze the pillow. Hold this for 3 to 5 seconds and then relax. If this causes you pain, squeeze the pillow gently to start with until it becomes more comfortable. Then gradually increase the effort as able. Don't forget to keep breathing. To work the outer thighs, you can wrap a scarf or a dressing gown cord around your legs and practice pushing out into it. Again, hold the movement for 3 to 5 seconds and then relax. Then repeat the exercise. Step-ups are a great strengthening exercise as we do this every day when walking up stairs or steps. Using the bottom stair of a staircase or a step, practice stepping up in a slow and controlled way. Start with a shallow step and you can try leaning forward slightly and squeezing your bottom muscles as you step up. You can either alternate the legs or stick to the same leg for longer for more of a challenge. To make the exercise more challenging again, and only if comfortable, try lifting the leg up as shown here. It can be a small lift or higher. Just remember to have something to hold to keep your balance. If you're experiencing pelvic girdle pain, we understand that you might feel worried about what positions would be most comfortable giving birth. You could try the following positions, but listen to your body and respond to what feels best for you. Kneel on the floor, or bed, or birthing pool, and then rest your arms on the chair, or the head of the bed, or the gym ball, or even the side of the pool. Perhaps being on your hands and knees is more comfortable. On your hands and knees, you can try turning your feet and lower legs outwards, which opens up more space in the pelvis. This can be a good position if you prefer to be on your side. The peanut ball can help support your upper leg whilst you're resting between contractions. Your midwife or your birthing partner can help move this ball as needed.
Diaphragmatic breathing, also known as belly breathing, is a breathing technique that can really help to reduce your body's stress response, helping you to feel more relaxed. Diaphragmatic breathing helps you to breathe deeper into your belly rather than taking shallow breaths into your chest. It can take some time to learn. In the beginning, you could try this exercise lying down, and once you've gotten used to the technique, you can do it in any position that you like. To begin, lie on a comfortable surface. If you're pregnant, prop yourself up so that you're not flat on your back. Or if it's easier, try this sitting in a position that works for you. Place one hand on your chest and the other on your belly. Breathe in slowly through your nose. Try to breathe deeply and slowly into your tummy. And as you're doing this, feel your hands moving outwards. Take a nice, full breath and then slowly breathe out. You should feel your ribs and your tummy gently move back down. Take this time to think about the tension in the rest of your body. This can be in your jaw, your shoulders, your bottom muscles, or even in your legs. You might be able to relax any areas of tension that you feel by simply practicing belly breathing. Have a go and see how you get on. Practice this exercise at any time of the day for 2 or 3 minutes at a time, although it can be helpful even if you do it for 30 seconds.
We hope you have found this video helpful during your pregnancy. Remember to take it at your own pace, and any movement during pregnancy can really help manage your pain. Please see our website for further information.